Hi guys, how are you doing? I hope you are doing well and welcome. So today I want us to learn about screening of cancer of the cervix. So in this video, it's just a short video to talk to ladies and also encourage them to come or to go to the hospital for cervical cancer screening. Why is it important to do a cervical cancer screening? It is because it helps to detect cancer cells early. Okay, if at all you have these precancerous cells, they can be detected early, so that you can be treated before they progress to becoming cancerous cells. Okay, so there is this rumors out here that cervical cancer screening is painful. So I want to let ladies know that it is not painful. It is just it has some discomfort, but it's not painful. Okay, so what is done? What is usually done during cervical cancer screening? We have two tests. There is one that is called a pap smear test, okay, or a pap test. This is when the doctor or the nurse or the gynecologist gets a sample of cervical cells. Okay, what they do is usually there's an instrument called a speculum. This will help your doctor to visualize your cervix. Then he will use a brush, a small brush, to take some cells from the cervix. These cells will be taken to the lab for investigations. Then from there, if there are these precancerous cells, they will be detected in the laboratory, and then your doctor will advise you. If they are present, your doctor will advise you. If they are not present, which is okay, you will be advised on how or how often you are supposed to do pap smears. We also have another one called human papilloma virus test. This is when the doctor will take some cells from your cervix, okay, and these ones will detect if you have those strains of the human papilloma virus that cause cancer. Okay, human papilloma virus has so many strains. There are those that cause vaginal warts, and there are some that cause cancer of the cervix. So your doctor will take the cells. They will go to test for presence of human papilloma virus. If present, they will see if you have those ones that cause cancer of the cervix. Okay, so when should a woman start doing pap smears? And all ladies who are 21 years and above, immediately you hit 21 years, you should start doing routine pap smears or routine screenings. So women who are between 21 to 29 years should do pap smears after every 3 years. Okay, so if you go to the hospital, you do a pap smear. If the results are okay, if they are negative for cancer of the cervix, you are required to do a routine test after every 3 years. But if they are positive for these cancer cells, then your doctor will advise you accordingly on how often you should be doing checkups depending on the stage. Okay, women who are between 30 to 65 years, those ones can do both a pap smear and also a human papilloma test. Okay, so you will do a pap smear and repeat routinely after every 3 years. You can do both. You can decide to do a pap smear and a human papilloma virus test at once, or you can do a pap smear after every 3 years, or you can do a check of the human papilloma virus test after every 5 years. Okay, are we together? So after 65 years, when now women reach 65 years and you have been doing routine screening and you have been negative for intraepithelial lesions that or negative for these cervical cancer cells, then you will be advised to stop now screening. Once you hit 65 years and above, there is no need of you doing more screenings. That is if you've been doing a routine checkup and then they have been becoming negative. They have been negative. That means you are negative or free of cervical cancer cells or these precancerous cells. But if they are present, then you will be advised accordingly. Okay, so in this video I just wanted to inform you that you are required to do a routine pap smear starting the age of 21 years. Okay, this one will help. Okay, this one will help detect these cancer cells early when they can be treated. Okay, and also it helps to reduce the number of deaths related to cancer of the cervix. Okay, so yes, that is it. Cancer screening is not painful. It's only that it has some discomfort because it's a foreign body, that thing, the speculum that helps to visualize your cervix, and also the brush that is used to get cells from your cervix. Those are foreign bodies, so you will have a bit of some discomfort, but it is not painful. So you are encouraged to go to the nearest facility and do your checkup. Okay, please, let's help prevent the cancer of the cervix. It is a killer disease. It has killed so many women, and you know what, it can be prevented. Okay, it can be treated once it is diagnosed early. That is the good news about it. So what we need to do is go for routine screenings. Okay, that is the only way that can help treat cancer before it advances to the stages that can't be treated. That is it. Thank you so much for watching. Remember to subscribe, share, like, and if you have any question, just ask them in the comment section. I will answer you. Okay, thank you so much.